Welcome everyone to Writing as a Nurse, Integrating Theoretical Frameworks. In this webinar, we're going to drill down on one particular assignment in Nursing 612. Whether you are in the BSN to DNP program or the standalone DNP program or one of our other things and looking ahead, welcome. We're going to be talking about something that has a profound effect on writing a literature review and how you approach a study or a project, which is to say the framework that you apply here. Now, this assignment happens to use theoretical framework as its title. We'll delve into how the idea of the framework actually can divide into two related things, the theoretical framework in its most literal sense and a conceptual framework, and we'll talk about the differences between the two. At this point in the term, you're probably familiar with the Writing Center, so we're going to pass by these in the interest of giving you back some time this evening. We have a few webinars coming up that you might be interested in this term, including, especially for nursing students, the methodology paper webinar coming up on Tuesday, June 8th. I'll be teaching that one there. And you also might be available in some of the webinar recordings that are available right now on the Writing Center website. So if any of these courses and assignments apply to you, then I'd recommend going to watch the webinar or to add the recording to your calendar to watch it. All right, let's us dive in here. So we have 4 learning objectives here today. The first is to understand what theoretical and conceptual frameworks are and their differences, to understand the week 4 integrating theoretical framework assignment in Nursing 612, to understand the related week 7 assignment that ties into, and the core principles to keep in mind when outlining the Nursing 612 week 4 assignment that we're going to dwell on today. All right, so let's start out with talking about what are theoretical and conceptual frameworks. First of all, there are ways of using prior scholarship and ideas to structure and guide your work, to align the things that you choose to focus on with what has come before, and say, oh, we are doing this because of X, because of this prior approach or model. And in that sense, we can see the framework as being a philosophical and methodological guide to what you as the author, what you as the researcher are perceiving as important in the work that you're doing, including the lit review that if you're in Nursing 612, you will be writing for week 7. This is also a means of situating your work within the stream of prior scholarship to say, okay, I'm not ignorant of what has come before. I'm not trying to create everything from scratch. I understand how this approach relates or diverges from what has come before. Or in short, we could just understand this as the frameworks are a way of not reinventing the wheel, saying, oh, we're following some particular example that has come before. So how are theoretical and conceptual frameworks different? Well, you could read a whole article about this if you really feel you need to, but let's break it down as theoretical frameworks outline a theory or small set of theories that support your research. And conceptual frameworks usually involve a less formally articulated set of concepts or an idea or approach that is being applied from a different concept into this, like taking a model of leadership and using this to inform how you go in and try and cultivate leaders, or how you identify who the most effective people to do an intervention are and how you raise them up within this care setting. And there are a couple ways that you can quickly distinguish how these are, whether you're working with a theoretical framework or conceptual framework. One of these is to just look, are you working with 1 or 2 theories? Then it's probably a theoretical framework. If it's 3 or more, well, then usually you're trying to knit them together into something new, and so that's probably going to be a conceptual framework instead. If you've got a model, a concept, or a principle that you're using to guide your study, it's a conceptual framework. And if it's some combination of 1 or 2 theories plus a model or something like that, then it's probably going to be a conceptual framework. You will see these terms used more literally in the sense that I'm describing them here, and more generally, in which case sometimes people will just say theoretical framework, I'm using this model to guide. In the program at ACU, use the literal sense. So if it scores as something according to these litmus tests here, then go with that particular label. And you will find, as in all cases, that there's some faculty who have stronger thoughts about the literalness than others. The way to be on the safe side is to use the conceptual framework when it passes the tests for 2, 3, and 4 here, and theoretical framework when it passes the question test for number 1. So why is this important? Well, the conceptual framework has, or the theoretical or conceptual framework has a profound effect on the research design that you would select for a project, an intervention, a study. And also, when you are writing a literature review, as is the case in Nursing 612, it has a strong effect on what you pay attention to and what details you seek out and highlight. So when you are approaching a general problem, the framework informs and decides what things you choose to focus on, what things you deem important. It guides the methodology that you use to address the specific problem that you approach, and your research questions, or the primary research questions, should be answering things that the theoretical or conceptual framework that you have chosen, backed up by your lit review, that these have highlighted as important. And ultimately, we want the research questions to determine the methodological inquiry that you select. Like, if your research questions are answering things that need quantitative data, then you want to make sure that your inquiry is a quantitative inquiry, and that this aligns with something about your framework that said, oh yes, these things predict this, or these show that this other thing. All right, let us move forward here, and let's get a bit more specific by talking about the framework assignment for week 4 in Nursing 612. So this is the scientific underpinnings to practice assignment, and one of the scientific underpinnings to practice course. One of the purposes of the course is to make sure that students have a strong foundation leading in to the main D&P coursework and the final project, the cumulative project of doing a project that it usually ends up being a quality improvement project or intervention of some sort. And we want to make sure that this is strongly grounded in the research that has come before. And in this case, this involves making sure that setting off on an inquiry, a literature review inquiry, is informed by a strong framework. So you're not trying to figure out how to filter things on the fly. It's this framework will guide the details that you do select. Now, this is related to the week 7 literature review paper. We will talk about that in a little bit. And key detail here, this paper requires that so the paper that's due this week requires that you identify a framework, model, or theory that you will integrate with your problem of interest and the PICO question. And so these are all elements that are supposed to be working together. Now, again, whether it is ultimately called a theoretical framework in the literal sense or a conceptual framework in the literal sense, the goal is to have this mechanism to look at the literature to try and address the problem of interest and ultimately answer your PICO. All right, so what are the things that we need here? Well, you need a summary of the key elements that are included in this framework and to emphasize how that is important, to explain how the framework relates to the problem of interest, to state how this is involved in supporting positive health outcomes, and to explain how you will integrate this into the larger problem of interest that you're trying to address, and how this will come up in your review of the literature. And ultimately, how this is going to be applied in the clinical setting. All right, well, that's fair enough. You only have 2 pages to do this, So you don't want to spend too much time on it, but there are enough things to keep track of that you should absolutely do an outline. And when it says that your sources should be less than 5 years old, keeping in mind that this is building towards your eventual Doctor of Nursing Practice project, I would say err on the side of newer rather than older sources. So if you happen to find choices where there's some sources from 2 years ago that will do what you need versus some that do the same thing but are 5 years old, pick the newer ones because then you won't have to worry about needing to update sources later on. All right, let's take a moment and review the criteria here. So we need to identify the framework, model, or theory being used. Okay, got that. Need to summarize the key elements and what this particular framework emphasizes. You might think about this as the difference between glasses for farsight and reading glasses. The reading glasses are about reading something close, and things far away get blurry, and the opposite is true with those farsight glasses. Now, often those of us who wear glasses are wearing glasses that are designed for general use when our eyes are able to adapt enough on their own. But as your eyes age, you might end up having separate glasses or having bifocal. So they're literally different lenses in your glasses for whether you're looking far away or looking down at a book in front of you. So, with that in mind, looking at what the key elements and emphasis of the framework are, that emphasis is like having those glasses, those reading glasses that will make the details close more clear. All right, illustrate how it relates to the problem of interest and what impact this has on supporting positive health outcomes. So that's definitely going to involve grounding it in the literature. And predict how you will integrate this theory into your problem of interest and the literature review that you write. With the note to make sure you explain how this will be applied in the clinical setting. So this is basically going through the things listed earlier, which is good. We check to make sure there aren't other things that are required. So let's talk about where this is going. So the literature review paper, I've extracted the instructions here. So the purpose is to work on formalizing your problem of interest into the PICO question, having that be grounded in an advanced literature review, and making sure that you're synthesizing the literature to answer your PICO question. Ultimately, you have to evaluate the quality of the evidence that's available, identify any gaps, and see how the evidence relates to practice. And probably there's going to be some gap there, either in the adoption or in additional research being needed to improve practice. And you have to write this in various chunks across the term. So again, this is reminding you that you will be using information from before. And I just wanted to point out that at several points in these instructions, it says you should be integrating the feedback into the final paper. So when you are done with the week 4 assignment, you'll get feedback from your faculty person, and they expect that feedback on your conceptual or theoretical framework section, that this will reflect the feedback when you put it into the larger lit review paper that's due week 7. And then again, this is important enough that it's mentioned twice. And as someone here from the Writing Center, I will say it is a good idea, if you have a lot of questions about the faculty feedback, to submit those drafts to the Writing Center for feedback, so you can see, are you following the instructions? If you need any clarity to explain and how to move forward on that. Try not to save all of this for week 7. If you are building a growing document as you go and responding to the feedback as it comes, you'll have a much easier time than if you try and do it when everything else is coming due. Something that is important to note in the week 7 assignment is that the literature review does ask for subheadings, that you divide it into areas by the content themes, or the larger content areas. And when you look at the literature review paper, what you're writing today, what you're writing for week 4, will be a section within it. And if we look at this, see, okay, start with the introduction, PICO question, search methods. All right, that's pretty straightforward. Literature review with subheadings for theme of content. Okay, so this is saying, all right, talking about the larger lit review section should have lots of clear subdivisions. And we also need to make sure that there's a clear integration of theory there. And that's the section that we're talking about right now, the conceptual or theoretical framework. Now, whether this goes inside the literature review, usually as the first section, or before the body of the review, those are both okay ways of placing it. What I do not recommend doing is placing it at the end, because the literature review's theoretical or conceptual framework explains why you highlight the details that you do and leave out those that are not relevant or not emphasized by that framework. So let's take a moment and refocus our attention on the assignment here. And I'm going to go ahead and I will grab a copy of our APA course paper template, and we will look at how you might start outlining this. So something that you might find yourself doing for your project and for this assignment is to be adapting something that was developed for another context to a new context. Now, there are multiple nursing care models here, and there are also related models in other fields. And perhaps you have a professional experience working in another environment, or you have colleagues in there, and you say, perhaps that particular iteration would be helpful here as well. And so in this case, we're looking at the comprehensive care model of dental care delivery. Now, dental care is, of course, much more limited in the scope of the body than nursing can be. But let's take a look at some of the precepts of this as laid out in the abstract here. So this paper happens to be talking about how predoctoral clinics moved from the traditional to comprehensive care. And so they were assessing the comprehensive care, and they checked patient satisfaction, and they found that there were really only a statistically significant differences in 2 of the 19 items that they were tracking. So saying, all right, well, there's no real difference in that. Now another question might be, well, how are your costs similar or different? And so you might find that if the research is not showing any strong differences here, you can pick the one that is being used for other factors. So you might say, oh, well, we are working in an area where we are perpetually underfunded, but we get more money if we're applying the comprehensive care model. And so we're choosing to do this a la the dental care model because of those anticipated benefits. That's one way to go about doing it. Another way is to look and say, okay, there is something that really changes how we do this. And let's go ahead and grab another example here. All right, so let us go ahead and look at this part here. So here we have a study here that is looking at total patient care in terms of job satisfaction. And if you're wondering why I'm looking at this, we have many students who are working at things that involve people other than the patients. For example, trying to address burnout, low retention, and other things like that. And so you might be looking at, well, okay, if the results are more or less the same for the patients, if the patient outcomes are good either way, are the staff outcomes in terms of things like happiness, job satisfaction, different if you're doing one thing versus the other? Now, if we just look at the abstract here, we see that there were some similarities and that when they were comparing primary nursing versus intensive care nursing, and so they recognized as that there were some limitations here, but they came up with that suggestion. So, looking at this, you may find that a particular model suggests something, and that's a good reason to test whether it works or not, which is so that might be part of your study. So, let us look here. Um, Now, as you can see here, I have some literature that I pulled up on different research on models related to nursing. And I do recommend that you read around a little bit before you select the exact model that you use, because that will give you a sense of how much it is in use and how much you will have that you can draw on in your literature review and this paper. So, for example, if I was going to this paper here on Benner's novice to expert model, which was applying it specifically to COVID-19 nursing, we can look at this a couple different ways. One of which is to look and see, well, how much has this been used? And say, well, okay, I want to go ahead and see how much stuff is there on this particular topic. So if I search Benner's novice to expert model here, I find that there's quite a bit. So if I were to choose this, I would have my choice of not only things about the model itself, but also model as it gets applied to different situations, which is very handy because I know I have to write the literature review that's due in week 7. So let's say I wanted to check, I'm wondering, does this work in, let's say, primary care? And there's less for that, in part because that's just the nature of the beast. There's a lot more specialization going on now than there used to be. Let's try another one and say, let's see if this is applied in a clinical environment. And we see a bunch of stuff. I want fewer handbooks and more journal articles, so I'm going to go ahead and I'm going to limit this to scholarly peer-reviewed journals. And I'm also going to go ahead and change the date here so that we're only looking at articles from the last few years. Because remember, the assignment requires it to be at least in the last 5 years. And we see, okay, that is now much more narrow. So I might decide, all right, I'm going to remove the clinic thing and just look and see, all right, with that last 5 years thing, Benner's novice to expert model. And you might also go ahead and remove Benner from the same set of quotes, because Benner didn't write it as Benner's novice to expert model, but someone else describing it. And you'll find that we end up with more or less the same results. So, okay, now this is enough that you could write a decent lit review and a decent framework section here. We want to go back and look at the underlying theory, and we can see it's being applied in a number of different formats. All right, so let's say I chose this one. So I have my article here that I'm going to browse. I, of course, want to make sure that I cite it, and to save some time, I'm going to go ahead and use the cite tools here. And remember, you have tools in the library catalog itself to help you do some of this work. So this button here, the yellow page here, that's your cite button. And we can pick the format of the citation that we're copying. We'll always want to check the formatting, but that will save a lot of time. And great, I can go ahead and I've got my template file open. And so I can head on down to my references section and go ahead and add that immediately. Go ahead and select match destination formatting. And then in this case, we want to go ahead and change this to lowercase. And model names are not capitalized in APA style, so that would all be lowercase there. Great. So we've saved ourselves some time on copying this, and we know that our framework will be based on this. And now, because this is a model, I know that, well, technically this is the theoretical framework assignment. I'm using a conceptual framework because I'm applying a model. And then we cite that just like we would any other source. And the question is, what are we citing here? We're citing it as a source for this. So we're not going to reference Ozdemir. That just happens to be the article we're using here. So we want to list Benner's novice to expert model. And that's where the citation goes. So the conceptual framework for this project is based on Benner's novice to expert model. And we give reasons. We explain what the model states is important, how it's been used, whether there was a high efficacy or not. Did we get a lot of statistically significant results or little? Why are we doing it here? And basically you start by saying, all right, so here's the framework I'm going to use. Here's what it does, and then explain it is suitable for whatever you're going to do because of, and then give the reasons there. All right, let's take a look back at the assignment again. So we need a summary of the key elements here. All right. And at this point, we can just go ahead and copy over the instructions from the assignment itself. And so we know that these are the major content areas. And so we can look at this and say, okay, we need to mention in the outline we need to say briefly because you'll expand on it later. So we understand we've got about 2 pages. We have our intro more or less laid out by saying, okay, here's the conceptual framework, here's how it works, here's what it's appropriate for, including the situation, how it will lead to positive health outcomes or help promote this, what we'll be doing in the clinical setting, and then just go and expand each of these bullets into a paragraph, keeping in mind that not counting the title page or the references page, this is a 2-page paper. If you write a paragraph for each of these, it's basically done. And in fact, for a DMP project or a doctoral dissertation, Usually the theoretical or conceptual framework section ends up being only about 2 pages anyway. So this is really all you need to do. All right, let's review the rubric here and make sure that we got everything. All right. And the rubric is just going through the exact same stuff that we were discussing earlier that are in the instructions. So at this point, it's not rocket science. It's a list of things to do. And the hardest part is finding that particular thing that you're going to use for your theoretical conceptual framework, whether it's a model or a theory or a combination of the two. It can have a very large impact because if you don't like it and you don't agree with it, it's going to be a lot less fun to do that whole lit review. If there's not a whole lot of literature on it, then it's going to be harder for you to get all the things that you want to have, and you'll have to do more inference, which is not ideal. But also, if you see that there's a lot related to this, then you can really cherry pick what you address to make it most relevant to the clinical setting and the specific problem of interest that you have. That concludes our webinar today. I hope that you have found this useful, and feel free to visit us at the Online Writing Center again, whether through our webinars, through an appointment, or any other channel. Have a great day.